Fox Connecticut News at 10.
Well, I don't have any official numbers to back this up, but I'm going to guess that maybe the two most common New Year's resolutions are to lose weight and, far more importantly, to quit smoking. So if you're a longtime smoker that recently quit, that quit a little while ago, or if you're even thinking about quitting, do yourself a favor. You can get yourself a free lung screening that could save your life one day. The Oncology Associates of Hartford, or the Radiology Associates of Hartford, forgive me, and St. Francis Hospital and Medical Center want to help you out. They are offering free screenings. I can't wait to tell you about them. But right now, I'm very happy to be joined by Dr. Joseph Colasanto. He is a radiation oncologist.
How are you? Thank you for having me.
Glad to have you. Thank you for being here to give us some knowledge about why this is so important. So, yeah, let's just start by talking about lung cancer. It is so deadly. What are screenings going to do to help out?
Yeah, the screenings are important. The lung cancer is a very common cancer. Prostate for men and breast cancer for women are the most common, but interestingly, more people die from lung cancer than from prostate cancer, breast cancer, and colon cancer combined. And the main reason is because it's caught at a later stage when it's more advanced. So the plan is to screen people with CAT scans early to catch this early when it's curable.
And how involved of a process is getting a CAT scan?
The CAT scan, it's a quick, low-dose CAT scan. Low dose meaning it's about 10 to 30% the dose of a typical CAT scan. So it's very quick and should be done by a professional that's used to reading these type of CAT scans.
How effective are they at maybe trying to find some of these lung cancers at their really earliest stage?
Very effective. It's been shown that it's reduced the finding them much earlier, reducing actually the risk of death from dying from cancer, because if it's caught early, there's a real risk it can be cured.
Yeah, that's what I was going to ask. You know, again, people keep hearing that lung cancers are deadly, and a lot of different cancers are deadly. It's mainly just because they're not caught in time. So
Right.
when you do catch it in time, about how survivable, how treatable is lung cancer?
If it's caught very early, it can be very curable. Very early stages, greater than 75% can be cured.
That is fantastic.
Whereas if it's caught later, the numbers are much lower.
Okay. Now, I want to get a lot of you down here for screenings, but we want to make sure we're getting the right people. So, Dr. Colasanto, let's start talking about who you want to see come down and who you don't want to. Who's in the greatest risk factor group?
Well, we want the high-risk group, people that are really at risk for developing an early lung cancer. And the high-risk groups would be active smokers, heavy smokers, or if you've quit within the last 15 years, and also between age 55 and 75. We would consider a heavy smoker someone, for example, that would smoke 1 pack a day for 30 years, which is the equivalent of 2 packs a day for 15 years.
Okay, so they are more or less interchangeable.
Yeah.
All right, so there you go. So if you smoked a pack a day, but you quit back in 2008, you're not really out of the woods.
That's correct. You should still talk to your provider and see if you're eligible for screening. Absolutely.
Okay. Now, about these screenings, they're going on here on the 10th, and they're going on in 2 different places at Radiation, forgive me, I want to make sure I get it right. The Radiation
Associates of Hartford, correct.
I don't know why I wanted to say association. The Radiology Associates of Hartford.
Yes.
That's on 31 Sycamore Street in Glastonbury. It's also happening at the St. Francis Hospital and Medical Center there on Woodland Street in Hartford. But we want you to know that there's a lot of spaces that have already been taken up on the 10th, so they are now offering more screenings happening on the 17th. So there are still some on the 10th and on the 17th. What else is there that we need to know as far as people who are trying to quit smoking now? Maybe they don't necessarily fit the profile, but how much can they help their chances by quitting today?
Yeah, it's very important. That's the biggest risk factor. It can increase your risk of lung cancer by 20 times if you're an active smoker. And the link was first discovered in 1939 when it was first published, and in 1981 is when the link was found between secondhand smoke and the risk of cancer. But that is by far the biggest thing that you can control to reduce your risk of lung cancer.
And you know what? Just to give people a little more incentive to quit in the short time we have left, forget about it in terms of just cancer. What can quitting smoking do just in the first 2 to 3 months? How can that improve somebody's health?
Oh, incredibly. I mean, just increased energy, lung capacity. There's a lot of benefits besides just the reduced risk of lung cancer.
That's fantastic. Yeah. Doctor, thank you so much for your time.
Absolutely.
We really appreciate it. It's great work that you're doing. Hopefully you can save a lot of lives, and that in turn saves us a lot of money and treatments and whatnot. But of course, lives are precious. So thank you again. Again, the 10th and the 17th in Glastonbury and in Hartford. Do not forget. We have to step aside for just a couple minutes, but when we come back,